Hi, I'm Dr. Dave Janda. Welcome back to the Operation Freedom platform and the ongoing series, our special segment series as it relates to your nutritional health and well-being. I'm honored to have back with me someone who I believe is the top naturopathic physician in the world, Dr. Peter Glidden. A little background on Peter. He attended Williams College. He then obtained his Bachelor of Science degree in pre-medical studies at the great University of Massachusetts. He obtained his doctoral degree in naturopathic medicine at the Bastyr University in Seattle, Washington. He is a member of the American Association of Naturopathic Physicians. He currently is in private practice of naturopathic medicine and has been licensed to practice naturopathic medicine since 1992. This is the fifth in the ongoing series, and this particular program is going to focus on how to prevent and address joint stiffness, pain, and inflammation. Peter, welcome back to the Operation Freedom platform.
It's always a pleasure, Dr. Janda, to be on the same platform as you. Thanks so much.
Well, that's very kind. Peter, the symptoms I've spoken about, the joint stiffness, pain, inflammation, are all components of arthritis, the two main categories being osteoarthritis and rheumatoid arthritis. Could you educate all of us on the two types and how nutritional support can be utilized to address arthritis?
Well, all right. I think it's an interesting little fun fact to know and tell that the word arthritis is Latin for pain in the joint, inflammation in the joint, right? So you've got pain in your joints. You go to a conventionally trained medical doctor, you pay your copay. I don't know how much in medical insurance you've paid your whole life. It's a lot.
It's a lot.
You've got pain in the joint. You go to their office. They do their song and dance, and they tell you you have pain in the joint, but they tell it to you in Latin. I've always thought that that's just a little silly. The American Medical Institution instituted a language monopoly in 1912 when they took over the delivery of medicine here in the United States, and they introduced Latin in order to make really simple stuff unavailable to the general public. So for goodness sakes, from our point of view, if you are starting to have pain and or stiffness in your joints, like the fella said, when the shoe fits, you don't feel it.
Right.
So when your joints are healthy, your body's healthy, you don't feel your joints. You don't realize you even have a joint because everything is good. So when you start to be aware of your joint, it's a little stiffer than normal, it's a little more painful than normal, or a lot stiffer than normal, a lot more painful than normal, that's like the check engine light on the dashboard. It's an indication that something is wrong. Now, pain medication, which is like an anti-inflammatory medication, which is the first, second, and third and fourth treatments with conventional medical doctors and then surgery, is like putting a black piece of tape over the check engine light on the dashboard.
True.
We still have a problem. We just can't see it anymore. We can't feel it anymore because the meds are masking the problem. All right. Now, it's better to attempt to figure out what's causing the pain, what's causing the stiffness, and address it. So, there's a saying in medicine, right, that when we hear hoofbeats, we think about horses before we think about zebras. We think about the most common things to cause things before we start thinking about esoteric things that cause things. We think about the easiest things to do rather than the hardest things to do to address the problem. So, if you are all of a sudden aware that you have joints and they are bothering you, then most probably what has happened is two things. Number one, you have unwittingly, regularly been eating food which is causing low levels of inflammation and making it difficult for your body to absorb the nutrients that it needs to keep the joints healthy. It's kind of like if every time you filled your automobile up, you did half a tank of unleaded and half a tank of diesel, well, it's only a matter of time until the engine starts having trouble. There's nothing wrong with the engine. It's the fuel you put into it. It's the same with the human body. So there are 12 foods that everybody needs to stop eating. That list is available on your website. That's a very important thing.
And that website is operationfreedomhealth.com. Right there. Top of
OperationFreedomHealth.com.
Yeah, right on the top of the page.
Okay.
Keep going, Pete.
Now,
yep.
This is an important thing to do because unless we address that,
correct,
it really doesn't matter how many herbs or nutritional supplements or even drugs we take, because it's going to be 2 steps forward with the therapeutic and then 2 steps backwards because you're still eating food that's causing harm. So we have to clean the diet up. And the benefit of eliminating the 12 bad foods is not only do your joints start to feel better, but a lot of things start to feel better. Mm-hmm. Because, again, the holistic model argues that everything's connected, right?
Correct.
So, number 1, clean your diet up. Number 2, you have to provide your body the raw materials that it needs, in this case, to keep the joints healthy. And probably the reason that the joints are becoming unhealthy is because over time, the food that you have been eating has had less and less and less and less and less and less of the raw materials that the joints need to be healthy. It's really that simple. So we stop eating food that's hurting the joints, and then we fill the body's nutritional tank up with joint raw materials. Mm-hmm. But the magic to our method, and the reason that this method is so very much more effective than anything I've seen in 30 years of clinical experience, is because it is fundamentally holistic in its application, right? Most people, when they start to think about giving their joints nutrition, they'll focus on 2 or 3 things, like, oh, let's take some glucosamine sulfate, let's take some hyaluronic acid, let's take some anti-inflammatory herb. And it's okay to do that, but what's a better plan?
Yes.
Is to give your body everything that it needs. Because remember, everything's connected. We give the body the foundation, 90 essential nutrients, in recipes that are actually absorbable, in doses which are appropriate for the person's weight. And then once we have the foundation in place and we've eliminated the bad foods, then on top of that, the icing on the cake, joint nutrients. When you do it that way, you get a much faster, much better, much longer lasting result. I mean, as you have already experienced in your own life.
Well, and I went to medical school. I practiced orthopedic surgery for 32 years. I have very severe arthritis in my neck and spine, and the way I was treated by my treating physicians was what I had learned through medical school, as you mentioned earlier, ever increasing doses of anti-inflammatories. And and then after one stopped working, they'd go to another, and then they'd add a second one. Well, that's when I came in contact with you. And Peter, the suggestion was, look, this stuff you're eating, Dave, you got to change the diet. And you got to go on the 90 essential nutrients, the start pack, the Total Body Start Pack that we have. Actually, full disclosure, Operation Freedom Health, that's where the products are. There are proceeds that come from the purchase of those products to our website so we can continue our work on this platform, YouTube as well as the website. Peter, I decided to do both because I could not keep taking ever-increasing doses of anti-inflammatories. And the first thing I did, I took your suggestion, I changed my diet, got rid of those 12 foods. Now, I also ordered the Total Body Start Pack. It took about a week to get there. So I changed my diet for a week. That week, I already started to feel better. I still stayed on the anti-inflammatories. And I started taking the Total Body Start Pack. And Peter, within a month, as you know, I was off anti-inflammatories completely. Prescription grade, no more.
It's huge. I mean, it's huge.
So, and frankly, when I went back to my doc, and the doc asked me, well, how many milligrams of Motrin are you taking now, and how many milligrams of Tylenol you're supplementing it with? My answer was none. And he looked at me and says, what? I said, I changed my diet and I went on these nutritional supplements and I'm doing stuff without having pain. So the bottom line, Pete, is that I'm a testament to the fact that I implemented what I was taught in medical school. And, symptomatically, it did help a bit, but the problem was there are all these side effects associated with these medications. And I wasn't addressing, as you said, the root cause of the problem. And Once I did that with the diet change and with the Total Body Start Pack with the 90 essential nutrients, it was done. So what's the action plan, Peter? Is it a similar action plan we tell our listeners?
Yeah, see, this is another common misconception in the modern day, that if you, for instance, have a bone or a joint problem, right, or a digestive problem, or any type of problem whatsoever, that you need to find a doctor to treat you, whether it's a traditionally trained allopathic MD or a holistically trained physician of some site, like a chiropractor, a naturopath, or whatever. But I'm telling you, in 30 years of clinical experience, that's not the first thing to do. And most of the time, it's not even necessary. The first thing to do is educate yourself about the simple steps you need to do in order to help your joints be healthy. And most of the time, that's all that you need to do. I mean, if you cut your finger, you don't have to tell your body what to do to fix it.
Right.
You just have to put a bandage on and keep it clean, for goodness sakes. Well, kind of the same thing here. So the recommendation is, if you are of the opinion that your body would benefit from having healthier and stronger joints, then it's a two-step program. Number one, identify and eliminate the 12 bad foods. You can get that list for free at operationfreedomhealth.com. Number two, provide your body with the foundation nutrients it needs, and then a little extra bone and joint health. And here's how you do that. The foundation 90 essential nutrients are acquired with the Healthy Body Start Pack. One Healthy Body Start Pack 2.0 per 100 pounds of body weight per month. In addition to that, as the icing on the cake, we would add one extra bottle of the liquid calcium. It's called Beyond Osteo FX. One extra bottle of the liquid plant-derived minerals. And one bottle per 80 pounds per month of liquid Glucogel Plus. So extra Beyond Osteo FX liquid, extra plant-derived minerals. Those are in the 90 essential nutrients, but we're taking extra. And then the real kind of key for healthy joints, the linchpin here that really speeds up joint health, liquid Glucogel Plus. One bottle per 80 pounds per month. Now look, if money's a problem because medical insurance doesn't pay for nutritional supplements, and I think that's a conversation for a whole nother episode.
It surely is. Right.
Then just get one bottle of each. Right? So it's one bottle of Beyond Tangy Tangerine 2.0, one bottle of plant-derived minerals, one bottle of Beyond Osteo FX, one bottle of Glucogel, and one bottle of EFA Plus. That's it. Just do that. I don't care if you're 500 pounds. Just do that, because your body needs this stuff, and it will suck it up, and it will use it. And it's better if you can take it all appropriate for your body weight, because you'll get a faster and stronger response. But even if you can't do that, do the foundation stuff. Do whatever you can afford, for goodness sakes, because as honest to God, as you are a living testament to, most people have no idea what they're missing. And this is the best kept secret in 21st century modern American medicine, as God is my witness.
Well, hopefully, Peter, with the viewing of this video, it won't be such a secret any longer. And I am living proof of your recommendations. Peter, I'd like to thank you for everything you have done, are doing, and will do. Folks, the 12 bad foods to avoid are all available on operationfreedomhealth.com. In addition, the products that Peter's spoken about are available on operationfreedomhealth.com. Again, full disclosure, purchase of the products does go to help our platform. In addition, and there's another foundation to your well-being, and that is Peter has authored 2 phenomenal books. They are available on his website, also at Amazon.com. The books are entitled Everybody is Sick and I Know Why, and Attempt a Cure with Holistic Medicine. They are the foundation of the Janda Medical Library. They should be the foundation of your medical library for your family. And I can assure you, the information in those books, when you take, some of our viewers have taken their books to their internal medicine doctors, to their family practice docs, and as the docs were paging through them, they asked our viewers, they said, can I hold on to this for a little bit and just kind of go through this a bit? And the reason is because I can tell you my training as an MD, We were never given any nutritional education. And it's best that you start your education, and you can always bring this to your physician, whether they're your internist, a family doctor, naturopathic doctor, although the naturopath is going to know about this, chiropractor, whatever it is. Again, Peter, I'd like to thank you for everything you are doing, will do, and have been doing. Again, folks, you can join us at OperationFreedomHealth.com. And as we end every segment, thank you for your time. And until next time, dream big and dare to fail. Dave Janda signing off. Thanks for joining us today.